welcome back to Infant Feeding Alliance's podcast. And I'm your host, Ruth Ann, and I'm here today with Dr. Clay Jones. He is a hospital paediatrician based in Boston, Massachusetts, and he is also a big advocate of science-based medicine and evidence-based medicine. And he has also criticised the Baby Friendly Initiative with criticisms that I and many other people who are involved in Infant Feeding Alliance really identified with from our own experiences. So, thank you so much for being here, Clay. It really is an honour. We know each other from Twitter, but this is the first time we've had the privilege to meet, and maybe not the last. We'll see.
Yeah, well, excellent to meet you, and I agree. Hopefully, not the last time we'll get together and have a good chat.
Yeah. So, if we start with the basics, what is science-based medicine?
Excellent, great question. Unfortunately, despite over a decade of writing for a fairly well-read blog called Science-Based Medicine, a lot of people still don't know what it is, and it's understandable because it's often superseded in people's minds by evidence-based medicine or EBM. And the reality is they're kind of the same thing. Evidence-based medicine, when done correctly, really is all you should need when it comes to deciding how to take care of patients. Unfortunately, historically, there's various sections of medical practice, particularly alternative medicine, that have flown under the radar of evidence-based medicine in many respects. And we developed, really, David Gorski and Stephen Novella developed the concept of science-based medicine in order to bring a focus back to basic scientific plausibility, being able to determine how to interpret the research on something controversial like acupuncture or chiropractic for babies, which is one of my big focuses, or homeopathy. It's a way to interpret the randomized controlled trials that are sometimes done on these really outlandish forms of practice, with, again, taking in the scientific plausibility, the basic science plausibility, and helping to make I think a better determination of whether or not something works or whether it doesn't. It looks at, how was the research done? What are the biases that go into performing research on topics like that? But again, evidence-based medicine should encompass all of that. But often people focus really on, the peak of the pyramid, the randomized controlled trial. And if that's been done and it says something works, well, then that's it. Decisions are final, something works. But what if it's thoroughly implausible, if not impossible? What if it worked, it would violate all the fundamental laws of physics and chemistry, such as homeopathy, again, for example? Then maybe there's something about the way those randomized controlled trials were done that we need to look at. So that's really what science-based medicine is in a nutshell.
Yeah. So why, and I think this is really important because we'll come back to this, because one of the things I really want to talk to you about is, what does science-based medicine and evidence-based medicine look like when it comes to looking after newborns and their families, and particularly issues around infant feeding? Why is evidence-based medicine essential for safe and effective patient care?
Well, I would say, in all aspects of medicine, but especially when it comes to parenting decisions and how do you care for a baby, how do you feed your baby, because there is so much personal experience, anecdotal evidence. And that's a big aspect of science-based medicine as well, that I guess, I don't know if I specified. It's how do you weed through all the experience-based medicine, kind of another EBM that we don't care for. Mark Crislip, one of the science-based medicine authors, famously said, "What are the three most dangerous words in medicine? In my experience." Because when we focus on our memories of how something happened when we, with all the biases in our thinking, when we focus on anecdotal reports, small case series, you can really, really go astray. And so with parenting and feeding your baby, you add in all the societal pressures, the cultural inertia, the emotional baggage that goes along with a lot of these decisions. You can really, really come to a place where you believe firmly that something is the absolute right way to do something. And there may be not only no good evidence to support that that's the right way to do something, there may actually be evidence that shows that's the wrong way to do something, the risky way to do something. And so science-based medicine, evidence-based medicine attempts, when evidence is available, of course, to weed through that. Of course, there's not always good evidence available, and sometimes we have to rely on small studies, anecdotal reports, case reports are just educated guesses. Certainly, that's true.
Mm. You see, my view, also as a clinician, as you know, is that that's actually where science-based medicine is helpful, because you begin to have a kind of theoretical construct by which to make sense of something in a scientifically plausible way. And no, you may not have the exact answers for your patient. You may not be able to say, look, if we do this treatment, then there's a 80% chance that your symptoms are going to resolve. And if we don't do this treatment, there's only a 10% chance they're going to resolve. So, you know, if you've got evidence like that, great, but often you don't. But it does give you a way of thinking that's very clear and that allows you to give patients your informed, educated guess, as opposed to your in my experience and my prejudices are.
And not only do we often, again, particularly with when it comes to parenting decisions, not have hard data with percentages of outcomes like you mentioned. We often, at least clinicians, medical providers, we frequently approach these scenarios armed with data, and this comes up a lot with breastfeeding versus formula feeding and whatnot. We come to the discussion with data based on large populations. What did a study show when it looked at 100,000 babies, or a population of a million patients? But when I'm talking to a family, when I'm talking to a mom who is in front of me crying, sleep deprived, not sure what to do, she's got the three F's of maternal guilt: friends, family, and Facebook, weighing her down.
Mhm.
I have to help her decide what to do for her one individual baby, not the 300,000 babies in the study, but her one baby. And it's a very, very different discussion and thought process that you can't come in guns blazing saying, well, this study showed that there was, a 0.03% reduced incidence of this or that. I have to
Right.
come in and talk with the mom and say, well, your baby may not benefit from this intervention, or they might benefit. That's unclear, but let's talk about all these other parameters that maybe weren't looked at in the study, or weren't taken into account, like mental health, your sleep, your overall general well-being.
Hmm. I mean, that's the art of applying evidence to clinical practice. You actually
Right.
can't take, well, the RCT says, does not necessarily mean, therefore, this is what you should do.
Right. and
And
and not only that, it doesn't mean that if you don't do what the RCT says, you're a bad person, which is, as you know, when it comes to feeding choices, that is the inevitable end result in many cases, is the assumption that the mom is either ignorant or uncaring.
mhm, absolutely. And of course, when we're talking about RCTs, like we have them. In fact, we don't really have RCTs comparing different feeding methods. Those large population-based studies are subject to all manner of biases in kind of which parents will breastfeed. Well, they're the parents who are probably healthier. They're probably orientated towards being concerned about health. On the whole, they're more educated and wealthier. They've got the resources. This is a different population than the
Absolutely.
population who are formula feeding, so it's skewed. And as my friend Vera Wild always points out, All the people who had terrible breastfeeding experiences, the vast majority of them will end up in the population of babies who were formula fed. So any adverse outcomes are in that group when they should be. These are the people who attempted to breastfeed. So
Right.
that's another kind of factor.
Absolutely.
Yeah. So let's talk about the Baby Friendly Initiative. So for anyone who's not aware, the Baby
Fun.
Friendly Initiative,
Neither, not baby friendly, but it's definitely a name they chose.
I prefer to call it the so-called Baby Friendly Initiative.
Right.
So the so-called Baby Friendly Initiative, the UK government currently has a policy that says every hospital must implement an evidence-based policy to support infant feeding and to promote breastfeeding. I can't remember the exact wording, but pretty much it says it must implement an accredited program such as the Baby Friendly Initiative. I'm not aware of any other accredited programs. So by default, every NHS
Yes.
maternity unit in the UK is baby friendly accredited or working towards
Convenient.
it.
Yeah.
So what is the so-called baby friendly initiative?
Well, it started over there with you guys across the pond, so to speak. Certainly has come to the United States, and our baby friendly USA folks, I think, in some ways, can be even more aggressive than what happens over in Europe. But started with I believe the WHO. It incorporates supposedly what I think are called the 10 steps to breastfeeding success. And it's things like, you know, you should have a lactation consultant. You should have, policies in place that support access to breastfeeding education and support moms. And so some of them make sense. And for instance, at my hospital, we're not baby friendly. Well, we're very baby friendly. We are not. We do not subscribe to the baby friendly healthcare initiatives, hospital initiatives. But they're just common sense. Like have people there who are trained that can talk to moms and help them through breastfeeding difficulties. But then they'll have things like avoiding pacifiers or artificial nipples and formula and rooming in where babies shouldn't go to the nursery. They should be with mom at essentially all times.
We don't have nurseries in the UK,
Yeah, and
only
and
in private hospitals.
which we can get into why that is problematic. But I don't know all 10 off the top of my head, but there's definitely some truth to some of the steps. And
Well,
when they
having a
go
lactation
ahead.
consultant, having a lactation consultant isn't one of them.
Oh, but it's having hospital
You have
like
to have a
resources devoted to.
You have to have a policy. You have to have a
Yeah,
hospital
yeah,
policy. It's
that's
communicated
true.
to all staff. That's one of them.
And it leads to situations where if a family chooses to formula feed, you have to jump through or use a pacifier, which I mean we recommend. The American Academy of Pediatrics at least recommends as part of a SIDS risk reduction strategy. When a pacifier when offered to a baby, you're putting down for sleep. But in order to get a pacifier, you may have to get a doctor's order. They might keep the pacifiers, in, not in where anyone could just get one. You have to like punch a code in, like you're getting a medication. Formula, you have to might have to have a doctor's order, like you said. You might have to have a nursery. And there have been studies, like the baby friendly folks will cite studies where they went into a hospital in a developing country and established all 10 steps and then saw breastfeeding rates increase and then said, well, we need to push all 10 steps. But what if maybe just two or three of the steps that make sense that like we do at our hospital without being baby friendly, maybe that was enough. Have there been studies showing that you need to restrict pacifiers? Have there been studies showing you need to force rooming in? And I don't think that those studies exist.
No, they don't. I've looked,
Right.
and in the main, they don't. And I also think that's an example of really bad science because if you change, I mean, one of the principles of doing good evidence-based research to find out what works is you change one thing at a time.
Right.
You
So
don't
you know
change 10
what
things at a
helped,
time, so you know what worked and what didn't work. And
right, or
maybe,
what hurt,
what
right,
makes things worse? Yeah,
right.
exactly. What hurt? What did harm?
Because I think restriction of pacifiers in many instances can interfere with breastfeeding success. I mean, if you're using a pacifier in order for, strategically, you're not just shoving a pacifier in a baby's mouth 24/7 instead of putting a baby to the breast. I mean, babies, in order for milk to come in, a baby needs to be placed to the breast or sometimes mom's pump. I mean, there needs to be generally some stimulation to encourage milk supply to come in. So if you're doing something in place of that, whether it's letting a baby scream in the corner or using a pacifier to calm them, if you're overdoing it, it may lead to delay in milk letdown. It may lead to frustration, and a mom deciding she doesn't want to breastfeed. But if you're thoughtful about interventions like a pacifier, you're using it to reduce stress, improve maternal sleep, well, dads too, partner sleep, but definitely maternal sleep, then that can only improve not just breastfeeding success, but just general health and well-being. It would reduce exhaustion and dropping a baby during feeds, reduce risk of getting in a car accident on the drive to the store. Again, some of these things haven't been specifically studied, but it makes a lot more sense to me that thoughtful use of a tool like a pacifier is beneficial than it is that it interferes with breastfeeding. And we don't have evidence, again, that pacifiers magically, as an intervention, interfere with breastfeeding.
Mhm.
Lots of
Yeah.
anecdotes.
And these are also things that I think are they're personal decisions. And,
Exactly.
I don't think you need an RCT to tell you what you should or shouldn't do. But yeah, common sense. I remember I obeyed the baby friendly initiative for a few weeks. And then I introduced a pacifier, or a dummy as we call them in the UK.
Yeah.
And I just remember seeing this kid suck so hard whilst looking quite euphoric. It
Yeah.
was
It's
just
a
like,
natural
"Ah,
reflex,
this is so
the
nice."
calming reflex. Right.
Yeah.
And you can
Yeah.
talk about potential risks and benefits of any intervention. There's no free lunch in medicine, as we say. And there are some potential downsides to pacifier use. In my educated opinion, I think the benefit outweighs the risk, but dental malocclusion and if used into toddlerhood, minor increased risk of ear infections. But, it's a lot easier to get rid of a pacifier than a thumb. There's the SIDS risk reduction, and some moms may decide, even if presented with the ambiguity of the research, even when told there may be a small statistical decrease uh, in your ability to successfully breastfeed to 2 years, a mom may decide that, well, that's very small risk. It may not be real, but the benefit of reducing the risk of SIDS is meaningful to me, and I choose I say that is, a benefit that outweighs the risk. And so, yeah, let the
Yeah.
family empower them to make their own decisions.
Yeah. This will make you laugh. I remember when my daughter was about 2, and they had like a kind of developmental review, and I went to the place where they had it, and on the wall it was like pretty much beware the dummy. And there was this horrendous picture of this kid whose teeth were like,
Mm-hmm.
basically they had like a hole
Going
in their
all different
mouth.
directions. Yeah.
The teeth were completely rotten. It looked absolutely ghastly. It's like, this is what dummies do. And I'm like,
Yeah.
look, that is a really tragic and horrible picture. And I really feel sorry for that child. But it's quite clear to me that kid has had a dummy constantly in its mouth, and probably had that dummy dipped in something
Yeah.
sugary
Coated in sugar of some
to
kind. Right.
lead to that degree of decay and that degree of malformation of the mouth. I was like, that is really
Right.
tragic. And then I was also, what are you doing to the mom who's choosing to use a dummy to settle her baby for a little bit at night? You threatening her with this?
Yeah. You're telling her she's selfish.
I'm like, that
She
is
shouldn't
that's
care
a
about her
horrible
own
poster.
sleep.
And I challenged them about it. I said, that poster, like, they're like, yeah, that's the effects of dummies. And I'm like, well, my kid used a dummy. And they're like, yeah, but did you stop? And I was like, well, yeah, she stopped of her own accord. And
Yeah. These are
well,
do.
that's good, because otherwise she'd have ended up like
Yeah.
that. I was like, okay, that's confirmed for me that I will not be taking anything you say seriously. Because I was like, what is this?
Yeah. And
It's
that's one of the unfortunate, and that what you just said jogged my memory about something that bothers me all the time. It's how often the propaganda that goes along with promoting breastfeeding, it infantilizes women. It treats them
Mhm.
like children. It has to hit them upside the head with these images and go in, really aggressively, as if, the only reason they would ever choose to use a pacifier or give formula instead of exclusively breastfeeding must just be because they're just ignorant of all the horrible things that can happen if you don't breastfeed it. And so yeah, I think it pushes a lot of, there's probably moms out there that want to breastfeed, would breastfeed, but are pushed away from it by these aggressive scare tactics.
for sure. Certainly, when I breastfed for a while, one of the things I felt constantly like I had to do was to say to friends who were formula feeding or who had formula fed, oh, by the way, I'm completely pro formula and doing whatever you like. And I'm not a moralizer, and I don't think breastfeeding should be promoted. Actually, I don't think you should be told you should breastfeed. And, don't think like, and I'm like, oh, this is horrible. It's horrible. This is just a horrible
Right.
position to be in. And then when I wasn't breastfeeding, there's a degree of relief because I'm a little more comfortable with being the rebel and adopting that role. That's
Yeah.
my own psychology there. But then it was like, it's stunned me how often I was kind of asked why.
Right.
I'm like, it's none of your business,
Right.
you know? But what are your concerns about the baby friendly initiatives? You've said, like, this is not my hospital. I get the sense that you wouldn't welcome it. What are your concerns with it?
Well, like some of the things we talked about, like, I mean, it's so aggressive. It often demeans and infantilizes women, particularly women in minority populations, women of color,
Mhm.
um, and because they're often treated as, again, as if we just need to educate them, as if these women can't make make an educated assessment of the information and come to a decision. But when it comes to the health of the baby, there are downsides. When you exclusively breastfeed a baby, and now most of the time it works out well, especially if a mom gets support, education on breastfeeding, help with latching, those kinds of things. Breastfeeding usually works out great, but not always. And there are significant percentages of kids that, well, first off, they're starving for a few days, and it's okay to not want your baby to be starving. And but severe weight loss, dehydration, electrolyte abnormalities, readmission to hospitals for severe jaundice or hyperbilirubinemia, as we call it, which in rare circumstances can lead to injury to the brain. Thankfully, rare. One of the things that I've written about on science-based medicine and think about a lot is something called SUPC, or sudden unexpected postnatal collapse. And this often occurs during the skin to skin that is very aggressively promoted in baby friendly hospitals, often unmonitored, meaning that there's not a nurse at the bedside watching this baby and this mom, the dyad here, where they're violating all the safe sleep rules. You're right. You've got a baby that's face down. We always say sleep on the back. You've got a baby whose face is potentially pressed against mother's breast. I mean, we say nothing soft, plush, anything that could get over the baby's face. You've got an exhausted mom. The lights may be off. If there's a partner, a helper in the room, they may be asleep on the couch, or they may just not know how to recognize that a baby is not breathing, has concerning color change. And there are babies every year that die during skin to skin, that die in the initial hours, even in hospitals. So it's sudden, right? It's unexpected because these are healthy babies. It's not like 23-week preemies where sometimes bad things happen. These are often term babies where no one at all expects them to have an event. And then a nurse walks in the room and finds a sleeping mom and a baby that is dead. Or a mom falls asleep during skin to skin and drops the baby, and they suffer an injury hitting a hard hospital floor. Again, this happens hundreds of times a year in the United States. I know it happens in England and the EU, all over the world, anywhere skin to skin is practiced. And skin to skin can be done safely. For instance, at my hospital, we do recommend in moms who want to breastfeed and who want to do skin to skin. Nothing's forced. But we encourage it in the first couple of hours to promote early latching and early breastfeeding. But a nurse is at the bedside. It's a bright room. Everyone's monitored. As soon as they are transferred to the postpartum unit, we actually recommend to not do skin to skin. Again, if a mom wants to, we don't take the baby away and say, no, you can't. But I may walk in the room and see a mom doing skin to skin, and I might just give her some education on potential downsides and talk about other ways you can snuggle and hold your baby and bond with your baby that can be safer. And
I mean, I'm a real fan of common sense in this kind of
right,
situation. It's like, are you fully alert? Are you exhausted? Are you on strong pain relief medication
right.
that
Have you
could
just had a
impact
major
your
surgery?
absolutely, and I can tell you some stories that will make you wince. When I had my baby, I was like, I'm really tired. She's not latching. I can't, I need to sleep. What do I do? And I was told to lie in bed next to her.
Yeah, and that's, as we know, that is
And,
risky.
and I
And
was noted in my notes that I was non-compliant with advice because I said, I will not do that.
and then you hear sometimes a lactation consultant make jokes like, "Oh, we promote skin to skin until college." Like, obviously, they don't mean that literally,
Mhm.
but it just tells me that there are people out there that are promoting breastfeeding who just have no understanding whatsoever of the realities of some of the recommendations they make, of the risks and the benefits. And other than helping with breastfeeding early, like there's early latches in a mom who for a mom who wants to breastfeed, outside of the NICU population, I mean, there are some definite benefits from skin to skin or kangaroo care, as we sometimes call it, in a NICU setting. Of course, those babies are on monitors, pulse oximetry, heart monitors. Those NICU nurses watch those babies like hawks. You don't hear of SUPC in a NICU, or at least that would be exceedingly rare. Those babies don't have that kind of monitoring when term kiddos or near term kiddos in the regular baby nursery. And for those kids, there's just not significant benefit after that first hour or two. And so,
What do you think the evidence, what do you make of the evidence regarding skin to skin and its benefits? Because there's all kinds of things claimed, like, and this is for healthy term babies. Okay, so
right.
NICU population is different, but it's going to help them to adapt to the outside world. It's going to help their temperature regulation. It's going to promote bonding. It's going to
Yeah. Although
colonize the
bonding, you got to be
microbiome.
careful because bonding is one of the most abused terms when it comes. I mean, it is wielded like a cudgel to guilt moms into doing all manner of nonsense. I mean, think about attachment parenting. Your baby's going to be psychologically traumatized if you're not attached to them 24/7 because they won't bond. But sorry, I didn't mean to cut you off.
Mm-mm,
I just
mm-mm.
bonding is a bit of the concept of bonding is a bit of a trigger for me.
And me. So we could go down this rabbit hole.
So I tell moms who mention bonding, or if it comes up just organically when I'm chatting with the family, that you can quote unquote bond, whatever that means. Which, I mean, what is a scientific definition of bonding, right? Who knows? But you can grow. You can have those good feelings. You can enjoy being around your baby, and there's no difference whatsoever in bonding between doing skin to skin with your baby or holding your swaddled child in your arms, face up, gazing into their eyes, watching them, getting all those surges of oxytocin, those feel good hormones, all that happens when you're snuggling with your baby in a safe way, just the same as if they're pressed against you in a way that has some additional increased risk. And there's no decrease in bonding. And I would argue you probably have a better ability to connect with your baby if you get some restorative sleep. So having your baby go to the nursery for 2 hours, right? 3 hours where they're passed out asleep, because most babies on day one sleep pretty much the whole day. You have to force them awake to get 3 or 4 sucks here and there if you're breastfeeding on that first day. If they sleep for 2 or 3 hours and you get a good nap, as much as we let moms get naps in hospitals with all our vital sign checking and that kind of stuff. And then as soon as the baby shows signs of hunger, if they wake up and they're rooting and smacking and ready to feed, the nurse brings the baby back, wakes you up and says, Timmy's ready to eat. And then you attempt to latch, you snuggle a little bit, you hold them. There's just as much opportunity and success in bonding and connecting and feeding than when you force the baby to stay in the room, skin to skin, where you don't get any sleep.
Yeah, I
That's
completely agree. And to me, this is where, a degree of common sense kicks in. How many arguments do you have with your partner when you're both exhausted?
right.
Quite a lot more than if you're both rested, So it's good for your relationship to get sleep. It's good for your relationship to get pain relief. It's good for your relationship to take care of yourself.
Right.
And that equally applies to babies. And the other thing I love to tell people, because most people talking about attachment and bonding have never studied anything to do with actual attachment theory. And I have. So
Mm-hmm.
I can tell you that attachment was posited as a drive. You cannot teach humans to attach any more than you can teach them to sleep or be hungry or to eat or drink.
So
They're
it's a
driven to do
hardwired
it. It's
phenomenon.
hardwired. It's wired
Right.
within us as mammals. We attach, we bond and connect, and my view is just enjoy it. I mean, my joke that I often tell people, it's really amazing to me. I get a lot of DMs on Twitter, and I also get messages from friends because I'm vocal about this kind of thing. And it's like, I'm not doing skin to skin every day with my 6 week old, and are we damaged forever? And I'd say, well, listen, telling people to do skin to skin for X number of hours in this position and that position. How would you feel if I wrote you out a manual and told you exactly how long to touch your partner, where to touch them, how many minutes to touch them for? Do you think that would help your connection with them?
Okay.
Would it improve your intimate life? Because that's how ridiculous this
Right.
is.
And unfortunately, one of the other that I not really, I'm joking, but it feels like one of the other things that is hardwired in human nature is to, when anything goes wrong with the development of a baby, is to blame their mother.
Mm-hmm.
And so, we say, like, you're absolutely correct. Like, there's really nothing the moms can do to interfere with the attachment process. It's hardwired, it's innate, it's human nature. But there are children who have developmental differences, there's neurodiversity, there are children who end up attaching to varying degrees, sometimes less so than what society, or particularly a family, would prefer. But when a child, say, has autism, historically we've said it must be mom's fault because she was cold, because she didn't bond with her child, didn't attach to their child. And we've moved away from a lot of that over the past
Mm-hmm.
couple of decades, thankfully. But yeah, all these concepts that we talk about with feeding decisions, they're so global in so many ways, and can extrapolate it out to how we treat moms when it comes to so many other things. And so many of the breastfeeding promotion propaganda is just, it's like someone wrote down and decide and to figure out the best way you possibly can to make a mom feel guilty, bad about herself, like a failure. And if that's Baby Friendly's goal, I mean, they've succeeded and then some in many cases. Certainly, I've seen many cases: tearful moms breaking down, not knowing what to do, feeling like they failed their baby, and it breaks my heart.
Yeah, yeah. Going back to, because I want to cover more of that, but I also want to go back to some of the risks associated with baby friendly and put them in the UK. So, baby friendly in the UK came in the early 90s and it has
Right.
expanded since then. And it will not surprise you to hear that I looked at a study between 2000, it was like 10 years between 2003, 2013, something like that. I'll put a link in the comments. And they found that rates of readmissions for newborns with jaundice and other feeding related complications, was the way they put it, had more than doubled. And I
Right.
know that the rates of those
Of course they
things
have.
since that study have further increased. How likely do you think that is that some of baby friendly's policies have contributed to that?
Oh, I definitely think so. Just because when you instill in a family fear formula, when you don't educate them on how to thoughtfully supplement the child when feeds aren't going well, when you, I think, unfortunately, in many cases, don't even educate a mom on, especially new moms, on how to even know in the first place when feeding isn't going well, then they're not going to supplement, and because they're afraid that they're going to let their baby down, they're going to let society down, they're going to let the lactation consultant that came to the house or they met in their clinic down.
Yeah.
So
So,
absolutely,
yeah.
we know that it takes time for milk to come in, sometimes longer than others, and we know that delay in milk letdown leads to increased risk of jaundice
Yeah.
and weight loss and dehydration, all those things, right?
Yeah. I mean, they're all connected. It's
Right,
basically which one are
exactly.
you going to get? I'm guessing based on just the state of the baby and their predisposition and their health status when they're born, and also how much they can tolerate
Right,
insufficient milk intake for a few days.
right.
Yeah. How, I mean, this is another thing because you were told, I remember information I got, if your feeds are, if your baby's not waking, if you're not getting wet nappies, if you are, if you see that the cheeks are full and there's signs of sucking and you can hear the baby
You hear
swallow,
gulping, yeah.
how adequate do you think those are?
I mean, I think it certainly helps,
Hmm.
but there's a reason why we recommend early follow up with the pediatrician or family doc, particularly for breastfed kiddos. I mean, the AAP recommendation and what we generally do at my hospital is if a breastfed baby is going home less than a couple of days of life, they should be seen within a couple of days of going home. So within 1 to 2 days, because you can educate. So particularly new moms, but really, I mean, it could be their fifth baby. When you're in the hospital, you've just had a baby, you're exhausted, like things we talked about. You're not necessarily receptive, and that you hear a million bits of information. And if you're a new mom, a lot of the stuff you maybe have never heard before. You maybe read a little bit in a book or went to a mommy class, but it's not the same as when you've actually got a baby there in front of you and you haven't slept for 4 days. So, I suspect that moms retain very little of all the information we throw at them. That's why, in general, when I send a family home from the nursery, my goal is, because they get taught about so many things from nursing, from the books we give. My main thing I focus on is safe sleep, because I feel like if there's one thing I want this family to remember that I told them, I want it to be a few little tidbits on how to reduce the risk of SIDS, because I mean that's the number one or number two likely thing to kill the baby in the next few months. But yeah, no, I think even an experienced mom, when you add a sleep deprivation, can misinterpret signals and think things are going well, and really their baby's not getting much. And you go into
Mm.
the nutrition's office and they've lost a significant amount of weight and they need help.
I know in my experience are the dangerous things that you say, but I have heard so many stories where actually the parents have been saying, we're concerned. We don't think our baby is feeding well. Oh no, it's fine. You've
Yeah,
had
well,
some wet
that's even
nappies.
worse, right?
Oh no, it's fine. And there's no weighing goes on. It's like, well, we observe the feed. It's fine. It's normal. And actually, a lot of parents feel their concerns have been dismissed and not taken seriously
Yeah.
until I know I have someone who's going to come on the podcast and share her story, but she said everyone's fine, it's fine, it's fine, it's normal until it was discovered the baby had lost a really huge amount of weight and very distressing. Or why didn't you feed them?
Right. Because
And
it must be the mom's fault.
it's her fault. It's the
Right.
mom's fault. And and I guess I'm wondering kind of how adequate are those signs, and what does safe infant feeding look like?
Well, I mean, I think those signs are very helpful. I mean, if you have a mom that if I'm let's say I'm talking to a mom on the phone, which I don't usually do as a hospitalist, let's say I am, and the baby's 4 days old, and they have an appointment with their pediatrician the next day, and she tells me, the stools aren't that thick black, tarry meconium poops anymore. They're yellow and seedy. She tells me that the baby peed 3 times in the past 24 hours, that when she puts a baby to the breast, he's gulping and then he sleeps for a solid 3 hours and then wakes up ready to feed. Even without a weight, I would tell the mom, well, that sounds all very reassuring. I think you can see your pediatrician the next day, versus if they tell me none of those things, I might say, why don't you give them a call and try to get in today rather than tomorrow? But so I do think that in many cases, like, you can tell that a baby is well fed, or at least things are moving in the way that they should, that they're probably not dangerously dehydrated. But I mean, obviously that we still have follow up for a reason. My big concern with, I think what safe feeding should involve is education on how to strategically supplement.
Mhm.
Even if a mom is saying, I don't want to give formula, I want to exclusively breastfeed. We of course support that, but I still think every mom should be, every family, because not just moms, every
I agree.
family should be educated on, okay, I support that you want to exclusively breastfeed, Timmy. I think that's great. Let me just give you a little bit of knowledge in case, let's say you have follow up 3 days from now, but it's tomorrow, and you see this, or this potential signs of poor feeding. Here's something you can do to reduce the risk of needing to be readmitted to the hospital, of having complications. And usually it just involves strategic supplementation, such as giving small amounts of formula that aren't going to interfere with the baby's you know hunger and waking up and wanting to go to the breast frequently, so moms still get that stimulation for the milk to come in. um, it's how to prepare formula safely. Or we may send them home with a few bottles of the ready to feed formula just in case. Yeah, I know that's frowned upon. The formula companies, I'm just a shill for big formula.
You're gonna get accused, and so am I.
But I mean, if you're empowering them, you're giving them education, you're giving them all the options that they deserve to have. Formula is not evil. I mean, people take things that happened decades ago, some shifty practices by a formula company, 30, 40, 50 years ago, and they've extrapolated, or now here we are in 2020s, and they still think formula companies are all evil.
Mhm.
And formula, and it's like, what's it? The genetic fallacy, I think, is what it's called. It's where you determine if something is good or bad based on its origins. But formula is, it's a liquid collection of nutrients and chemicals. Like, it is nutrition. To say that formula is bad because in the 1970s Hershey or Nestle did something untoward is just absurd. And I think that colors a lot of the discussion about formula.
Mhm. Oh, for sure. And I think there's also a lot of things said, like, this is gonna stop you from breastfeeding successfully.
Right.
And I'm like, does the evidence suggest that?
No.
What does it suggest?
Yeah, nor does offering a pacifier. It's the whole concept of nipple confusion. Or you hear, oh, well, the babies will just like the formula better, or they like the bottle better because it's easier. Because the feeding mechanism in humans is so fragile, right? It hasn't been
Like bonding, it's
developed.
very fragile. If you don't do it right, it goes wrong forever.
Right. You look at that baby funny and they're just going to stop feeding, as if it hasn't had, millions of years of evolutionary development. Like we are born knowing how to feed. It doesn't mean that it always goes perfectly. And there are babies born with problems where they need help with feeding. But the overwhelming majority of babies, that is a hardwired reflexive action. And it is ridiculous to think that a pacifier, any more than a thumb, no one says thumb confusion, right? It's always nipple confusion, but they're perfectly fine with the baby getting their fingers in their mouth. And they don't say that's going to somehow make the baby not understand how to take a breast, a nipple in the mouth, mom's nipple. Yeah, it's to me, it's laughable how we act like that these babies, their feeding mechanism is just
Yeah.
so fragile. It's
So
not.
if humans have evolved to breastfeed, I mean, that's an argument that the breastfeeding advocates would join you on. We're designed to breastfeed. Why is it that,
We've
in the
also been
UK,
designed to have appendicitis and lower back pain and vision problems. Uh, that is is a fallacious argument to say that because something has evolved in a certain way, that is the best way, the way it should be, or that
Mm.
we can't help things along with modern technology and science.
Why do you think? So in the UK, if you believe the statistics, and I think this one probably isn't far off, 80% of women who start breastfeeding stop well before they had hoped to.
Well, before what? Say that last part again.
They'd hoped to, or well before they'd intended to.
Gotcha,
So
gotcha.
someone says, "I'm going to breastfeed for a year
Yeah,
or more," and 2 weeks later, they're like, "I'm exclusively formula feeding.
yeah. And
I
then
never
reality
want
sets
to."
in. So maybe we haven't. So their argument would be the only possible reason a mom would want to breastfeed and then change her mind would be that she is wasn't supported enough.
Mm-hmm.
She wasn't helped. That it's all external, and it's all again the infantilizing of women. We it's just assumed that a mom can't, as new information comes in, change her mind,
Mm-hmm.
which is just
So,
absurd.
what the research in the UK, this is survey research, would suggest is that the reasons women say they stop. Interestingly, sleep deprivation isn't on the list, although I would be staggered if it wasn't a factor for a lot of people. Is
Your
pain,
surveys, right?
latching difficulties, or insufficient milk supply.
What if, and I'm just going out on a limb here, Ruth, really just total out on a limb.
Go for it.
Stop me if this is just completely wrong. What if a mom never really wanted to breastfeed or never felt strongly about
Mhm.
it or changed her mind, but because she was afraid that society would think she was a bad mother, there needed to be a reason why she couldn't breastfeed other than she just didn't want to anymore.
You know, I could I could believe that to be a certain factor, but I don't think women are lying. I think, I stopped because of a
Oh, I don't think they're
combination of
lying
reasons,
either.
but
There's
it can be very painful. And that doesn't mean, I remember when I had really painful breastfeeding, it was like, well, the baby must have a tongue tie. We can't see a tongue tie. Maybe it's a posterior tongue tie. Get it cut anyway, even though it's invisible. Try some cranial
yeah,
osteopathy.
sure.
Um,
Get the baby's neck
maybe
adjusted, sure.
there's like, I had someone ask me if my nipples were normal. I was like, I don't even know what that means. Um, and it's like we're going to pathologize the baby or the mother in some way. They've got to have something medically terribly wrong that they can't do this natural thing. And maybe that's just evolution. Maybe evolution's a bitch and birth
Oh,
is a bitch. And maybe breastfeeding is too sometimes.
yeah,
And it's
no,
not for everyone. Some people enjoy breastfeeding, and that's great if you do.
and it's easy for some people,
And
certainly.
it is easy for some people. I know people for whom it's easy. I know some people who described it as a transcendent experience of deep connection with their baby. and they really loved it. And then
Right.
they also felt guilty for loving it too much.
Well, but how much? Again, I'm just spitballing here. I'm not a psychologist. You are.
Hmm.
But how much cognitive dissonance plays a role, right? So the harder something is, the more challenging something is, the more you potentially just don't like what you're doing, but you feel like you have to do it because of external pressures. You know, you really want to talk it up in order to justify the hardship that you suffered
You
while
know,
doing it.
I think I would turn the tables and I would say, how much cognitive dissonance is there for health professionals who have encouraged women to breastfeed, who have told them it's going to help them bond with their baby, who've
And prevent
encouraged
the
them to
baby's
have
leukemia.
C-section, prevent that baby from getting
Yeah,
leukemia, and
baby's going
how
to go to
much
Harvard.
dissonance is there for them in acknowledging, maybe these initiatives aren't so great after all.
Right.
Maybe there has been some dire unintended consequences, and we need to revisit our practice.
Or maybe the majority of the evidence base is kind of crappy that everyone cites when
It's
they talk
so
about promoting
crappy.
breastfeeding. No, I agree. I think there's cognitive dissonance all around for all of
Yeah,
us. I'm not impervious to it. Everyone
no,
wants
none of us
to,
are.
right. Everyone wants to go to sleep at night feeling good about themselves. Everyone is the hero of their own story, right?
Hmm.
And I certainly don't want to feel like when I'm, because of all the thousands of women I've talked about strategic supplementation with, that maybe I've been the cause of moms who have ended up not breastfeeding when they really wanted to, and their baby, like, had to go to Brown instead of Harvard or something like that,
I
right?
don't think that's very likely.
Or ended up at a party school like LSU, like I did.
Yeah. You know, the other thing I would say is that, eh, do you want to breastfeed is not the same question as do you want to breastfeed if your baby struggles to latch, if they don't sleep for more than an hour at a time, if every time they do, it's extremely painful. Those are not the same question. Do you want to breastfeed
Absolutely
and have
right.
this beautiful image that we present of breastfeeding and how serene and wonderful and bonding it
Yeah, that's the
is not
expectation
the
almost
same
all
as
moms have, right?
exactly, and it's not the same thing.
Right.
And I think as well when we talk about it doesn't work for everyone, I think it doesn't work probably represents some quite significant adverse effects for a lot of people.
Right. So I think the take home is that the reasons why moms choose to stop breastfeeding is factorial, right?
Mm,
There's
many.
all over the place, and we should have open, honest conversations with
Mhm.
families so they have all the information, all the data, and they can come to a decision, and then we should support that and do everything we possibly can to not make mothers, regardless of whether they breastfeed through the struggling, or decide to formula feed. We shouldn't make them feel less than, like they're bad moms, that they shouldn't feel guilty. Maybe we should take, like, as a society, take a step back when it comes to breastfeeding promotion, because, like, we're probably causing more harm than benefit. But
And
then people say, but it saves a million lives a year or something like that, which, again,
based on some very dubious data. I mean, this is the
right,
thing, when
right,
you start to explore the data, it's like, well, again, this is a statistical model which assumes that this population level data, so big studies, that it's not a randomized trial. This is comparing those who breastfeed versus those who don't. And who goes in which group is sometimes, because it's not straightforward. These are not two categories. Most people, in fact, have done both. And then you are kind of extrapolating from that and assuming that if a baby is breastfed and does better, it's caused by the breastfeeding, which of course you can't do that. That's
right.
statistics
It
101.
must be the chemicals in the breast milk, not the environment surrounding the breastfeeding.
Absolutely. And it just gets, but that gets me onto another point. Do you think that the health effects of infant feeding decisions are fairly represented on the whole?
Oh, no, no, absolutely not. Right. I mean, it happens in very in mom's faces ways,
Hmm.
very overt, upside your head. Like, you do know that your baby won't be obese, they won't get cancer, they won't get respiratory infections, and they're going to have a higher IQ, right? That's why you should breastfeed. But then it's also really subtle ways. It's snide comments. It's, oh, you're not breastfeeding? Like that simple comment right there. Again, I always joke about friends, family, and Facebook. If you bump into an old college friend and you've got your 2-month-old with a bottle in their mouth, and all they say is, "Oh, you're not breastfeeding," and they don't say anything else, that does its damage, because the assumption is you should be breastfeeding. So no, we absolutely give a false representation regarding the benefits. And when I talk to here's my spiel when I talk to mom, because frequently they say, well, we don't want to give any formula because we heard this or that. And my way of explaining it is that, as a pediatrician, we recommend breastfeeding. That's the party line. American Academy of Pediatrics recommends breastfeeding. But there are numerous reasons to not breastfeed, one of which is because you just don't want to. And that's okay. We support you. When it comes to the health benefits, they're largely based on large populations. They're difficult to pin down specifically to the chemicals in the breast milk. It could definitely just be the environment surrounding the breastfeeding, which a family who is formula feeding can have the same environment of many of these babies who are breastfed. That may be and probably is more important than the chemicals in the breast milk. And that when you look at how many babies you need to potentially breastfeed in order to see some of these uncommon potential benefits, it can be large numbers. So I usually will, kind of off the top of my head, say something to the effect of, you may need to breastfeed hundreds of babies for thousands of hours to prevent one respiratory infection. So when it comes to your particular baby, when it comes to Timmy, you may breastfeed him exclusively for the next 2 years, and he may have no benefit whatsoever compared to the baby next door who might be bottle fed for his entire first year of life.
Mm-hmm.
So there should be no guilt when it comes to these feeding choices. You should base it on your personal beliefs, viewpoints, feelings, understanding of what we discussed, what you've read, and we're going to support you either way, and we're going to answer any questions you might have. That's kind of like my, I don't say like word for word like that, but that's my general
Let me
approach.
ask you something more controversial. Do
Sure.
you think the American Academy of Pediatrics should recommend breastfeeding?
I think that the section of the breastfeeding section of the AAP is full of people who are a little bit overzealous. I think that we should have more nuance in our discussions of breastfeeding. So you're absolutely right. Just by me saying, the American Academy of Pediatricians recommend breastfeeding, that implies if you don't breastfeed, you're going against the recommendations, and so you're potentially internalizing that as, I'm a bad mother. And so you have to be careful about the language. And I'm sure I don't always avoid that, because it's hard to.
It's also everywhere.
It's everywhere, right?
It's everywhere, and of course, none of us want to go against our professional bodies, even if we have personal opinions that may be different. But I can be controversial because I can speak as a mother, and this is a personal opinion, not a professional one, to be very clear. What if the recommendation was, first of all, your baby should be fully fed,
Right.
and all of their nutritional needs should be fully met in a way that is comfortable and sustainable and even enjoyable for your family.
Right. And conducive to sleep and good mental
And
health.
conducive
100%.
to sleep, mental health, and that's a very personal decision. And when it comes to any actual health effects of breast milk versus formula milk, it's very difficult to say anything for certain because it's based on such uncertain evidence, because population level studies are basically shit for determining causality.
Right.
So we don't know, and therefore we're not in a position to say one is better than the other. And so the recommendation is feed your baby fully and in a way that is as comfortable and safe and ideally enjoyable for you. And I also caveat that with, I also recognize that in some contexts, formula may not be safe if you don't have clean water, for example. So,
Oh yeah, yeah.
you know,
Definitely depends on the context of
caveats
where you are
here.
living.
Although what I'll also say is that doesn't mean that breastfeeding is sufficient in those contexts either, because women in those contexts
Right.
will have low supply. They may also be more likely to have malnutrition and may also have higher rates of HIV infections in some communities, which can be transmitted in breast milk. So it's not a straightforward kind of recommendations. But how would you feel if the American Academy of Pediatrics came out tomorrow with that as their new recommendation?
Oh, I would be 100% on board with that. I think that that's a thoughtful and caring way to broach the subject. You just have to be prepared when families, more likely colleagues, right? I mean, because for me, because I frequently pull my punches
Mm-hmm.
when discussing breastfeeding, a little bit with say students, families, colleagues. It is so fully entrenched that breastfeeding is, again, not just the right thing to do from a scientific standpoint, but in many cases the right thing to do from a moral standpoint, which
Mm-hmm.
lends itself, which is why a lot of I think the data is skewed because of the way research is designed. It's often
Yeah,
done in such a way as you're trying to prove breastfeeding is best, not answer the question
absolutely.
of if breastfeeding is best. But then potentially I lose some credibility if here it's this pediatrician who is saying breastfeeding isn't that important. I mean, once on Twitter, I got a lot of pushback when I made the comment years ago that in the list of the most important interventions that determine the future health, the thriving, the success in life of a child, breastfeeding would not even be in the top 20. And the amount of vitriol and pushback I got from that is extreme. And
Wow.
so it is difficult to be, as a pediatrician, to be a little bit more, I think, honest, in my opinion, about the
I mean
situation.
that. I mean that is so striking, isn't it? It's like because I feel like there's such an intrusion of morality into clinical practice, and I come from a mental health professional background, so we've seen and we do see what happens when morality creeps into clinical practice, and you start to end up trying to treat people because they're gay, for example, and you end up with all kinds of, you know, horrible interventions that have done great damage to people. So morality, I think, needs to be separate from clinical practice, and we need to be guided by science and evidence. And I guess two principles: science and evidence, plus the principle of patient autonomy and individual
Yeah,
autonomy.
right.
Just to sum up, because I've taken up so much of your time, what's your big message? What would your wish list be? If you could change infant feeding policy, what would you like to change?
Uh, I think it would treat breastfeeding and formula on equal terms in a way that you mentioned so eloquently earlier. I mean, I think that is right on the money. That would help remove a lot of the guilt that
Hmm.
moms experience. I think that would, in many ways, might help improve breastfeeding rates if you take a lot of the pressure off, and strategic supplementation early on likely can help with sustaining breastfeeding. So I think we are shooting ourselves in the foot in many ways
I
by being
agree.
so dogmatic about it, so
I
aggressive
agree.
about it.
Thank you so much.
Oh, my pleasure. Great talking
No,
with you.
and you.